Do you ever feel like you're missing out on some old world secret your grandparents knew? A simple remedy they just knew worked for all sorts of everyday complaints? Well, gather around because today we're talking about one such marvel that's having a huge comeback: castor oil. It's been whispered about on every corner of the internet, from helping those nagging dry eyes to making your eyelashes fuller, battling pesky eye bags, and even shockingly being claimed to tackle serious issues like cataracts and those annoying eye floaters. If you're tired of guessing what's fact and what's just wishful thinking when it comes to your precious eyesight, you're in exactly the right place. I've rolled up my sleeves and dove deep into all the modern science to separate the truth from the myths. And let me tell you, some of what I discovered about castor oil, and your eyes might just surprise you, even things that could genuinely help improve your comfort and vision right now. Let's begin by discussing how castor oil might help with a common and often irritating problem: dry eyes. This is where many eye doctors are quite familiar with castor oil's role. You might not realize it, but castor oil is actually a common ingredient in many over-the-counter eye drops found right at your local pharmacy. If you take a moment to glance at the list of ingredients, you'll often spot it tucked away in the inactive ingredients section. It even serves as a carrier for certain prescription medications for dry eye. The magic behind castor oil for dry eyes seems to be twofold. It acts like a protective barrier, helping to prevent the tears on your eye's surface from evaporating too quickly into the air, and it provides extra lubrication, making it easier for your top eyelid to glide smoothly over the eyeball instead of causing friction. One fascinating study visually demonstrated this effect, showing how an irregular and unstable tear film dramatically improved and stabilized after treatment with eye drops containing castor oil. In fact, participants in that study who used these castor oil-containing drops 6 times a day for just 2 weeks reported significant relief from their dry eye symptoms. More impressively, their tear film became more stable and they experienced fewer issues with their meibomian glands, those tiny oil glands on your eyelids that, when clogged or not working well, are a major culprit behind dry eye. This is especially promising since so many of us deal with this common issue. It's very important to note, though, that these beneficial eye drops didn't use 100% pure castor oil. Instead, it was a small, carefully diluted amount within the formulation. You might wonder, why not just use pure castor oil directly on the eye then? Well, as we'll see, there are some important safety considerations to keep in mind, which we'll discuss shortly. But first, let's explore some exciting research about using pure castor oil on the eyelids themselves. Moving beyond dry eyes, some promising studies have looked into using castor oil specifically for issues affecting the eyelids. A compelling randomized study from 2021 explored applying castor oil to the eyelid as a treatment for blepharitis, a persistent inflammatory condition that causes irritation and affects both your eyelids and eyelashes. In this research, participants gently applied 100% cold-pressed castor oil to the outside of their lash line, similar to how you might apply a thin cream twice a day, morning and night, for 4 weeks. The results were quite remarkable. They not only observed a notable improvement in the visible signs and bothersome symptoms of blepharitis, but also saw a measurable reduction in the thickness of the eyelid margin, a decrease in telangiectasia, which are those tiny, noticeable spider veins that can sometimes appear on the eyelid surface, and even a reduction in matarosis, which is the unwelcome loss of eyelashes. Additionally, participants experienced less eyelash crusting and an improvement in what's called lid wiper epitheliopathy, that irritating friction feeling caused by the upper eyelid rubbing against the eyeball when it's dry. So, despite being a smaller study, these findings offer exciting support for the beneficial role of castor oil when applied to the eyelids themselves. Now let's address some of those more widespread claims you hear floating around, starting with under eye bags and eyelash growth. Many people wonder if castor oil, with its noted anti-inflammatory properties, can really help reduce those puffing under eye bags. While I couldn't unearth any direct studies specifically examining castor oil's effect on eye bags, it's worth remembering that the study on blepharitis did show a reduction in lid margin thickening. This makes us wonder if perhaps it could contribute to reducing swelling around the eyes. However, we genuinely need dedicated studies to confirm this. Separately, there's the exciting prospect of castor oil for growing stronger, fuller eyelashes, a claim often highlighted on product labels. Despite this popular belief, specific scientific research definitively showing that castor oil grows eyelashes is surprisingly hard to find. What we do know is that castor oil has a history in traditional remedies for early hair loss, and it chemically resembles prostaglandins, substances well known to encourage hair growth, including that of eyelashes. This is actually how certain glaucoma medications and many commercial eyelash serums work their magic, by using similar compounds. And remember, that blepharitis study did observe a decrease in matarosis, or eyelash loss. So while it might not directly cause growth, it's quite plausible that castor oil could play a supportive role in maintaining the overall health of your existing lashes, potentially preventing them from falling out prematurely. Now for the two really big questions, the ones that hold perhaps the most hope and concern. Can castor oil genuinely help with cataracts or eye floaters? After thoroughly sifting through countless scientific papers, I have to be straightforward with you. I found absolutely no studies whatsoever linking castor oil to improvements in either cataracts or eye floaters. This means we simply don't have scientific evidence to say it helps or hinders these conditions. A key question in my investigation became, is it even physically possible for castor oil to reach these deep parts of your eye? Both cataracts and the vitreous humor, where those annoying floaters form, are deep inside the eyeball. I delved into some fairly complex research on how substances travel within the body, trying to determine if castor oil could penetrate deep enough, past layers like the cornea, conjunctiva, sclera, or blood vessels, to actually impact these internal structures. While some of that science can get a bit technical, the overwhelming indication is that it's highly, highly improbable that castor oil could ever penetrate so deeply into the eye. So even if we consider castor oil's general antioxidant and anti-inflammatory benefits, it just seems incredibly unlikely that it could reach the areas needed to prevent cataracts or reduce eye floaters. If someone has tried castor oil for these serious issues and believes they saw an improvement in their vision, it's far more probable they were experiencing a placebo effect, or perhaps the castor oil was incidentally alleviating some underlying dry eye, which in turn made their vision feel clearer. As with so many aspects of our health, we always need more focused research to truly understand these complex connections. After weighing all the evidence we've discussed today, it's only natural for some of you to feel curious about trying 100% pure castor oil directly on your eyes. However, before considering such a step, there are crucial safety concerns you absolutely need to be aware of. Remember, the key often lies in concentration. All the beneficial studies we've talked about for dry eyes used castor oil that was significantly diluted, usually to about a 2% concentration within commercial eye drop formulations. The reason for this careful dilution is simple. 100% pure castor oil is incredibly thick. If applied directly, it doesn't mix well with your natural tear film and can leave stringy residue, leading to very blurry vision. More importantly, studies have shown that highly concentrated castor oil can be cytotoxic to conjunctival cells, those vital clear cells covering the white part of your eye. This means it can cause irritation and potential damage. Furthermore, research also highlighted a concern regarding how castor oil is stored. When kept at warmer temperatures for a few weeks, its acidity level can increase, making it potentially even more irritating to the eye. Finally, and this is perhaps the biggest reason most eye doctors are wary of people self-applying undiluted castor oil to their eyes. Commercially available castor oil from the store isn't regulated like medicinal eye drops. This means there's no guaranteed way to know its exact composition, and critically, it's rarely sterile. An unsterile product applied directly to your eye carries a significant risk of infection or other serious complications. Simply put, we lack robust research to confirm the safety of putting raw, undiluted castor oil directly into the eye. Therefore, above all else, please talk to your eye doctor before applying anything new to your eyes, especially a substance like castor oil. They can offer personalized advice, discuss any potential benefits or risks, and ensure your eye health is properly monitored. So, to summarize our findings from these often smaller but illuminating studies, while diluted castor oil in approved eye drops shows clear promise for dry eye syndrome, particularly when related to meibomian gland issues, and 100% pure castor oil applied to the eyelids appears beneficial for blepharitis and overall eyelid health, the evidence does not support using it for internal eye conditions like cataracts or floaters, and direct application of undiluted oil to the eyeball carries notable risks. We encourage you to share your experiences and questions in the comments below, as your stories contribute to this ongoing conversation. Stay informed, stay safe, and always keep your eye health as a top priority.